Welcome, Gyno-Curious listeners. I am Dr. Amy Novat. We are here to investigate what it means to be a healer and to be healed. I'm so happy to welcome Laurel St. Romain into the Gyno-Curious space today. Laurel is a Brooklyn-based florist originally from Texas, a place we could talk about a lot, but we won't. She moved to New York in 2006 to pursue a career in fashion, and finally in May of 2018, started her own floral design business, a longtime dream of hers. Shortly after leaving the stability of a full-time job, she found out she was pregnant in August of 2018, only 3 months into starting her new business. Laurel tells me that everything that has happened since has been unexpected, but incredibly beautiful. Today, we're talking about one woman's pregnancy journey, her courage, strength, and the many challenges Laurel faced during those 10 months. Her story is her own, but speaks to so many issues I have heard over the years as women face pregnancies, the myriad body changes that occur, the impact of our psyches, our jobs, our relationships, and ultimately the impact of our labor and delivery experience and how they can shape our memory of the entire experience. Our body never forgets this unique and remarkable event. And one of the reasons I asked Laurel to join me today was there's a lot of mythologies built around women and pregnancy and the abundance that our body provides. And I can only reflect on my own pregnancy story, which was full of challenge. I did not particularly enjoy being pregnant. I was many, many months. I was working and on call every other night during my first pregnancy, and sometimes on call every night for a week straight. And I had a very paradoxically unsupportive community around me. So I was working with OBGYNs, and you'd think they would be the most supportive. In fact, I was really ostracized as a result of getting pregnant during my last year of residency. So I had my defenses up constantly around how to protect my body, how to figure out how to be in an operating room when I need to pee every 20 minutes, to the expectation that I was going to call out any time and then leave it to my cohort to assume all the responsibilities. And so part of what I want us to explore today is the beauty of childbearing, but also the shadow of it, and that there are so many persons out there who are bearing children, and they feel isolated because they think, oh my gosh, my experience wasn't perfect, and everyone around me seems to have had a perfect pregnancy and delivery, and it's bullshit. It is just not true. And for those who have chosen not to have children, with great respect, here is our story. And for those who have had children and their experience has been both positive and challenging, here's our story. And Laurel, I can't thank you enough for being here with me today.
Thank you for having me.
Pleasure.
I'm excited.
How old were you when you got pregnant?
I was 36.
Okay. Can you just begin to tell our listeners kind of the story of the creation and storyline of your daughter, please?
Sure. Found out I was pregnant about 2 or 3 months after leaving a full-time job that I'd had for a very long time. It was like everything in my life was changing, and I had just started this business, and I was getting back into being a creative person again. I'd lost my creativity, and it felt like in creating this business and in working with my hands and just changing my life, it almost gave me the ability to create life as well.
No coincidence there.
It really didn't feel like a coincidence. It wasn't anything that I had planned. I certainly would have never said, wow, this is a great time to do this, when I really have no idea what I'm doing with my life or my company. I didn't know anything. And I didn't know if I wanted to have an abortion or not. I felt really lucky to have the option to explore. I had never talked about it with my partner. So when I told him, he was shocked, to say the least. Not ready. He wasn't ready for months. Neither was I, really.
It's interesting, for lack of a better word. Women will come into my office, and some women are so clear this is what they want to do. And then there are so many women who are just teetering on this edge that feels really precarious for them because do I or don't I? Not only do I want to get pregnant or not want to get pregnant, but what if I am pregnant unexpectedly? What do I do? And I have to apologize to our audience. You know, the way I love that women talk is in these beautiful tendrils and outward spirals that come back around. So we might go there today.
Mm-hmm.
But what I was going to say was that it's all about our choices are not always clear. And even if we make a choice, does it always feel 100% right? No. So few of us live in that black and white space, right? We're almost always in this liminal space, which is the beauty of it, but certainly the challenge.
It is, absolutely. And I felt lucky to even have the choice. Like I said, if we were somewhere else, like you mentioned Texas before, people don't have the choice. And if you do, but it's a lot more complicated. Let's just put it that way. And it's a difficult topic because there's people that try very hard to become pregnant. And there's people that know immediately they don't want children. I thought I was one of the latter. I never really thought about it. We never talked about it. So when it happened, I was scared. I think more than anything, I was scared. And before I told anybody, I went to my gynecologist. I took the test and she came back and the first thing she told me was, congratulations.
Oh, it drives me crazy.
I remember feeling so sad when she said that because I was just like, how do you know that? Like, I'm terrified. If you can't read that, then your bedside manner is pretty terrible.
The
like,
presumption,
I'm
right?
shaking,
Yeah.
And I'm not shaking with excitement. I'm shaking with fear. And for you to come out and tell me congratulations already tells me that you don't support my choice at all.
That's right.
The choice I haven't even made yet. But the fact that I have a choice, you're not really supporting it. And that was probably the first of millions of comments that I got similar to that. Just unsolicited advice.
What this podcast is about and all that will follow are stories and the stories that us women and men have to say around their life experience, around healing and being healed. And it drives me utterly bonkers when I'm working with a peer who has their storyline front and center and is not listening. And I think any of us who've ever been a patient, and myself included, I've been a patient along the years, I walk into a room and I realize that the doctor has already determined my future, my fate, my decision-making. It's, whoa, wait a second. And I'm frequently saying to patients in my office, if you are given a diagnosis or you're given information, the first thing you do is stop, breathe, listen to your own heart, gut, mind. And if the doctor in the room already has this choreography that they've reiterated over and over again, I empower you to say, excuse me, that's your story, not mine. So yeah, congratulations is so full of assumption and, oh my gosh, years and years of expectation that every woman wants to bear a baby.
Exactly.
Yeah.
Yeah, that's how it felt. It felt like part of my decision was being stripped away. Yeah, I left the office and I called my mom and she gave me the exact reaction that I hoped for, which was a choice. And she said first, wow. And then she said, whatever you choose to do, I support you. And that made me feel really good. It let me think about things for a while. And I guess I always knew I was going to go through with it. I thought this is the most inopportune time to do something like this, but I always have that everything happens for a reason mentality and thought this could be a really special person and let's do this. But it didn't stop me from exploring options and it didn't stop me from feeling really alone during it because it can be such a lonely time. Nobody really understands what your body's going through and everyone's pregnancies are so different. So when someone compares yours to theirs or theirs to yours, it's just not ever going to be the same. And when your partner's kind of not there for it, you're left to feel quite lonely. And he, of course, came around. He's home with her now. They're making forts and stuff. But
Excellent.
He's a great dad. Yeah, we all came around. But for the first 7 months, it was just me and my pregnancy alone.
Yeah. So you mentioned several things that I want to tease out. One is about timing. it's so interesting. We live in a world that is so mechanized, and there's so many aspects of our life that is based on the clock and the determination of the kind of outer social constructs. But this thing called pregnancy, it's rare that you meet someone who says, oh yeah, we stopped using contraception and we got pregnant the next month. That's rare. And is there a perfect timing for pregnancy? For many folks, there's no perfect timing. Women in the office will frequently say, oh, I don't have enough money, or I just started a new job, or my partner's not quite there yet, or whatever. And to all of our listeners, if you're looking for that perfect timing,
Doesn't exist.
exactly. And we kind of discover that throughout our lives in all aspects, right?
Absolutely.
Yeah.
I think that goes for most things.
Yeah.
More, it's, what do they say? The best laid plans.
That's right. That's right. That's right.
Yeah. You'll never have the amount of money you want or the freedom from work that you want. And the one piece of advice that I got early on that was actually good advice was, it's going to work out. Like it just will. You'll make it work.
Yeah. Yeah.
And I've always made it work, but this actually came easier than I expected. Like it's just trusting in the people that love you and trusting in the village that you make. They all really pulled through and continue to this day.
Yeah. Well, if you didn't mention the word love, I would have. Because it's, I'm a scientist. It's in our body, in our cells. And again, both the richness and the challenge, both the beauty and the burden. And if anything, parenting teaches us it's about both, right?
Yes.
Yeah, yeah. So you also brought up this concept of kind of the public sphere of pregnancy, that everyone came up to you and had something to say. And I feel so compelled to tell you my version of that story. I was living in the city, or no, I was visiting the city, and I was in a department store, a very fancy department store. And I was going up the elevator, and I was very obviously pregnant. And I was standing in this kind of semi-crowded elevator, and I'm looking at the numbers above, thinking, okay, I'm getting off on the 7th floor, or whatever it was. And all of a sudden, I feel a hand on my belly. And I look down, and there's this stranger, a woman, who's got her hand on my belly with this wide grin and starts telling me, oh, how nice, and again, congratulations, and all of this stuff. And I had this immediate reaction was I took my hand and shoved hers off my belly. And I said to her, I turned to her and I said, excuse me, who do you think you are? This is my body. Yeah. Would you put your hand on my pussy? That's how I was furious. I felt so offended. And then I calmed myself down. And I looked at her, I said, thank you for your compliments, because she was trying to build community with me. That's what she was trying to do.
Yeah.
But it was just not the right approach for me. Maybe it worked for others. So can you speak to me about how the public responded to your pregnancy, and both in the positive and the negative, if you will?
Yeah, I think the public who didn't know me, so just the general public, like in your story, would have never known I was pregnant. I carried very small. She was born at 4 pounds, so you can imagine I carried small. I pretty much just gained weight everywhere and didn't really show. It was also winter, so big coats, and I dress already in like oversized dresses and things like that. So it was very hard to tell. So no one gave me their seats on the subway when I felt really nauseous and sick. And we were traveling to Italy and I felt really sick. And I just felt like such a baby the whole time because I just looked like any normal person. Like I didn't look pregnant at all. So there was that. And then there was the people that did know that would make the well-meaning comments like, oh, wow, you don't even look different, or you're carrying so small, or telling their partners like, I'm not going to look like that when I get pregnant, so don't expect me to look like that. Those kind of things that are well-meaning, but after the fact, after my daughter was born, like there was something going on with her and there was something that we didn't know that was going on, which is why I carried small. So all of those comments now, thinking back, like they just hurt to think of them because we didn't really know that there was something going on. And yeah, so now when I look back, they were well-meaning, but it's also plays into the view of women and like, we should be these small, delicate, like it's bad to gain weight when you're pregnant. It's so silly. You're pregnant. You're
right. When pregnant women in the office say, I'm getting so fat, I have to like squash that and
Yeah,
say, no,
absolutely.
you're not getting fat. You're getting full with the abundance of pregnancy and the
Yeah.
weight that you need in order to support this pregnancy. And, obviously there are some women who gain a lot of weight and there are women who gain lesser weight. But again, it's this public opinion
Mm-hmm.
around what is appropriate, might I say, or normative or expected.
Yes. And now with social media, everyone is an expert and has something to say about what you should and shouldn't be doing and shouldn't be eating and shouldn't be doing. And it's just endless.
Yeah, I suspect it was different when we lived in tribes where we were literally surrounded by the matriarchs and the other vulva havers in their experience in pregnancy, where literally the community supported you, fed you, housed you, supported your baby once the baby was born. I can get the beauty of that. We don't live like that anymore, for better or for worse. And I'm glad my mother wasn't with me all 10 months. But it's a very isolating place.
Yes.
And yet there's this weird paradoxical influx of all of these comments from people you don't know or even people you do know. So it's a bizarre paradigm, I guess I'd say.
It is. And it's weird. It's weird now, too, because to bring it back to social media knows you're pregnant and it starts feeding you all kinds of things for pregnancy. You need these prenatal vitamins and you start feeding you the accounts of these other pregnant mom influencer people. And now you need this specific bed and this baby food. And, oh, you shouldn't feed formula or you should feed formula. It's just too much information. And suddenly you're already scared and you're already lonely. And now your phone is telling you all of these things. It's just overwhelming. And it's just everyone's an expert, but nobody's really an expert.
That's right. And the commercialization of pregnancy,
the business of it
all is not speaking to the individual. Absolutely not. Even though Google would like to say it does, it's got an algorithm that's looking at only Laurel. Again, it's false. It's so patronizing, I find.
And it's as false as the people that put out there that it's so easy.
Yeah.
And it's so beautiful and nothing ever goes wrong.
Yeah.
There's a lot of that in every aspect of social media. It's just this way of washing away all of the negative, all of the bad. We just present the good and it makes people feel, what am I doing wrong? Why doesn't it feel like that for me to be a mother? I love my child. Like, why don't I feel like this lady looks like she's got it down and it's easy and she's like feeding chickens and then her kid's just running behind her barefoot and they look like they live in this like insane painting. And I can't imagine her yelling at this little boy and I can imagine her forgetting to do something. And it's just not real. I just wish people would be a little more real about the experience of being a parent because it's hard. And there's a lot of the way you were parented comes out when you're parenting. You start sounding like one of your parents. Like I counted to 3 the other day and I was like, what am I doing? I used to hate when people would do that to me.
3. Why 3?
I know, as if that's going to make a difference. But it's just funny how it all comes out like that.
Indeed. We learn so much about ourselves during this journey, don't we?
Yeah. Oh, yeah. Yeah. Especially if I'm a perfectionist. So having a child is challenging.
Yeah. Let's back us up. Let's, talk about being pregnant. And I remind myself when I'm having conversations with women that my own pregnancy, my first pregnancy, I've been pregnant twice. And my first pregnancy with my son, the only thing that calmed my belly was vanilla milkshakes from McDonald's, their fries, and essentially any cookie I could find. And this is what I basically ate for the first trimester because anything else just made my nausea that was already so prominent even more pronounced. And so I like telling that story because, again, here I had all the knowledge. I had the expertise. I knew nutrition was important in my pregnancy, but I had absolutely no choice. I had to have a vanilla milkshake every day. Or I would
probably can't even look at them now.
Totally of no interest to me. Totally. And as soon as I delivered, I don't
Yeah.
eat that anymore. And I
mean,
got back to my vegetarian.
yeah.
So it's so interesting. Tell us, so as those months evolved, you mentioned that your daughter was, sounds like premature. Can you tell us about that experience?
Yeah. So all this to say, I had a very easy pregnancy. I didn't have to buy a bunch of maternity clothes. I worked like crazy. I probably worked more than I've ever worked when I was pregnant because I felt fine. And I was also scared that I wasn't going to be able to work once the baby came. And I didn't tell anyone that I worked with I was pregnant because I do some physical labor. And I didn't want people to be like, well, we can't hire Laurel because she's pregnant, even though I was only 3 months pregnant or 4 months pregnant. Like, I just didn't want anyone to know because there's always that stigma of don't hire the pregnant person. So everything was fine. Everything was easy. And I went for a routine checkup, and it was right around a little bit before 8 months. I had just done a workout class, and I was wearing a ridiculous outfit. I was dressed like Wednesday Addams before the Wednesday Addams show came out. It's like a little black velvet dress with a white collar and some knee highs and some platform shoes, and I went to my routine checkup.
The question I have to ask is, did you have fresh panties on, though, since everybody has to have fresh underwear before they go see the doctor? I never understood that.
I did. I actually did, because I had worked out and I changed into a whole new outfit. I went straight to the doctor, and I hadn't eaten yet. This always sticks out in my head because I was really hungry. I got there and I was planning to have this lunch after, and he was kind of listening, and then he said, the heart rate is sounding a little bit irregular, so I would like for you to go up to Lenox Hill and have them take a look at it there. It's probably nothing. And I was like, okay, let's go. So I told my boyfriend to meet me up there. We went up there. The technician was looking on the sonogram and kind of making comments like, look, there's the Handos. She's so cute. And it was a whole bunch of that until it was nothing. And then she left and didn't come back for a while. And I knew something had to be wrong because it was a bunch of blah, blah. And then it was just, uh-oh.
Silence, yeah.
Yeah. And so a doctor I'd never seen before comes in and says, there's an irregular flow of blood in the umbilical cord. You need to have the baby today. And that's the last thing I remember. That, and then the feeling of really having to go to the bathroom. Just like, I'm going to actually shit my pants because I'm so scared right now. Like, I'm not supposed to have her for like 5 more weeks. And I'm wearing this stupid outfit. And I have to walk up to labor and delivery in platform shoes and knee highs and a Wednesday Addams dress. I'm embarrassed. I'm scared. I'm like, nothing is working out. And I didn't feel ready, and not in the sense of emotionally ready. There wasn't any sign in my body that was telling me gonna come out now. I could have stripped down naked and I would have had the little boop, like a small little, it wasn't ready. Wasn't the time. So they send us up, and I'm a mess. I'm freaking out. I don't know if I need to like poop or cry or vomit. And I'm still haven't eaten at this point. And now I can't eat because at any minute could be a C-section. So now I'm stuck and I don't eat for many hours, 48 hours or something.
Yeah. Wow. Yeah, that's so hard. Particularly, there is something about bear with me, kind of the mechanistic way in which we look at pregnancy, right? 2 weeks, 3 weeks, 5 weeks, second trimester, etc. That it's very demarcated. How pregnant are you? And there's this response because you've been counting the weeks or counting the days.
Size of a watermelon.
That's
size
right.
Of a,
exactly.
I think it was pineapple. I think she was a pineapple. Pretty sure.
Exactly.
If I remember correctly.
Exactly. So when this range of fruits or the arc of the months is all of a sudden halted or shifted, it's incredibly challenging. And as you well know, you're not alone in the chaos that happens when a baby in utero is demonstrating distress. But for each woman and her partner, or if there is no partner on her own, experiences around this. And I without making fun, it's so remarkable what we remember in the face of trauma, what you were wearing, right?
Yeah.
Because all of the other
stands out
stuff.
so much.
Yeah, yeah. And it's because I'm sure all the medicalese that was being said to you was foreign and not understood and perhaps not even explained. And I'd like to ask that question. Do you feel like in the face of that emergency, were the doctors and nurses talking to you? Were they telling you what was going on?
No, and my doctor, who I didn't really have much of a connection with anyway, was not there. And from my understanding, when someone says she has to have the baby now, I thought it was like go upstairs and it's going to be here in 10 minutes. I didn't know. So
Right.
I didn't know it would be almost 2 days of them trying to make it happen. And it's funny because now, after my daughter was born, she's 4 now. So I have a lot of knowledge of this medical speak, and I know way more medical terms than I ever wish I did. And she spent 3 months in the NICU, so I know how to do all kinds of stuff. I know what everyone's talking about there. I could get up and turn off the one kid's feeding tube, and I could say that kid over there is desatting and needs oxygen, and this one's having a Brady. Like I knew it all, and it was weird, and it just became normal. But
Yeah.
I didn't feel like it was explained to me. I didn't know what was going on. Everything felt weird. And it was like, all right, get this gown on. I hadn't eaten. I hadn't drank water. They couldn't find a vein. It was just so hard. And finally, they started with induction. And again, like nothing was really explained. It was like, going to try this strip. And then it's not working. We're going to try this balloon catheter. And I'm thinking, I just don't like the sound of that. I know what a catheter is, and now you are adding a balloon to it, and I don't know if I think this is a good idea. And that thing didn't work. And then there was a cream, and that didn't work. And they went back to the Pitocin, that didn't work. And then it was the knitting needle breaking the water, and there was no, can we do this? And I didn't even think you feel very powerless. Like I didn't know what was going on. I didn't know if any of that was necessary. Part of me wanted to just say, just give me a C-section. I don't want to go through this anymore. Like, it's not helping. And maybe she doesn't need to come out right now. The blood flow wasn't right and the heart rate wasn't right. And it was just 48 hours of this trying to make me dilated enough. And it just wasn't working. And the amount of times people come by and check that, it felt really violating.
Yeah.
Too. Because it's done very thoughtlessly, usually by a resident or whoever's attending, and it's just check the cervix. And I would clench every time someone came in the room and just be like, please don't check it. It's not any bigger, I promise. Like I can tell nothing's happening.
I think for far too long, particularly in the world of OB, where it was mostly male physicians, the idea of asking permission, like the woman who touched me in the elevator.
Yeah.
Even, again, as a physician, I remind residents and medical students, this is someone's body. And particularly on a labor and delivery floor, we're not talking about listening to someone's heart, which is also, you're touching somebody's body, but you're putting a finger inside someone's vagina. There's very little, I don't know that there's anything as invasive without, if you will, or colonoscopy. It is extremely intimate. It is extremely personal, and it's extremely invasive. And this is happening all while one might be contracting, or one is trying to figure out what's next.
And I didn't know anything, and I was just scared.
Yeah. And it's interesting. I've often asked myself, why do physicians, clinicians behave like they do? And I think there's an element of fear for them too, and that their reflex is, I don't really know what's going to happen, so I'm just going to act. And rather than just taking a moment to say, okay, let me explain this, quite frankly, it would help their heart rate, but also the patient's.
Yeah.
And I think the greatest lesson I ever learned as a first-year resident was in the face of an emergency C-section, for example, I would close my eye. I'd literally be at the table before cutting, and I would close my eyes and count. And I would just take deep breaths, because I knew that if I got in there and just went, even if I had just seconds, that it would be like, me on 5 cups of coffee, and it's just chaos. And that's not the right way in which to help someone get through an experience like that, both for myself and the patient.
Absolutely. And these people didn't know me. They weren't my doctor. And
Right.
then when he finally came, he did a little bit of a better job explaining what was going on, but it was still just, I remember when finally it was like something started working. I guess the knitting needle did its thing and things started moving along. And immediately I was just scared. And I said, just give me the epidural. I barely feel anything, but I don't want to feel anything. I'm scared. I'm just too scared. I'm not the type of person who I don't have something to prove. I'm great for people that can make it without the drug, but I was not ready to experiment with that. I was already so scared and tired and still starving, honestly. But once it started to work, they all came running in and they're like, with emergency, caps on and razors and take off all your jewelry. And, my boyfriend had just gone to eat dinner. I was like, I got to call him. I'm still starving. I'm going to have a surgery right now. What's going on? And I think there's just, no one tells you anything when they're doing this. And so when they brought me, I was so scared and I already had the epidural. So they gave me whatever they give you to have the C-section, whatever numbing that is. And no one says, okay, this is going to make you feel freezing. You're going to feel so cold. You're going to shake like you're jumping off a table, but you're really not. But your body's going to feel insane. Nobody tells you that. So when it's happening to you, I thought it was like a fear response. And I was so scared that I was so scared. I thought this is not normal to be this scared. And finally, the anesthesiologist was there and I asked her, I was like, I think I'm dying. Like, I think I'm having such a bad panic attack. And he's like, oh, no, that's just the medicine. And I asked him if he had ever had it done to him. And he started laughing and he said, no, why? I was like, I don't know. I feel like maybe you should so that you could tell someone what it's going to feel like. Because you actually have no idea what this feels like. I feel like I'm dying because I'm having such a bad panic attack. And I'm afraid that I'm so afraid. And I've never heard anyone come out of their C-section and be like, wow, that medicine really made me freezing and made me shaky. Like they just glaze over it like it never happened. So no one gets that information passed down to them.
Yeah. So thank you for sharing that, because spinals, which is the anesthesia of choice for C-sections, absolutely can create a whole host of side effects. And, what so saddens me and infuriates me about your story is the universality of how helpless we feel in the face of those events, and how poorly we as clinicians communicate. And my hope is that maybe as more and more women enter the residencies of OBGYN, and it's happening all over this country, there are some residencies that are 90% female, that maybe there will be more sympathy, empathy, communication. But I don't, gender doesn't make us who we are.
Yeah.
It certainly doesn't make us who we are as communicators necessarily. And so I think that in spite of that gender demographic change in residencies, that the lessons have to start early on in medical school.
Yeah, and there's also, I guess, in the face of what was deemed at that point an emergency, there isn't the time for all the explanation, I guess.
I don't know. I don't know about that.
I don't think it could have been that much of an emergency. Like,
well,
they did ask me if I wanted what music I wanted to listen to. And I thought, well, if it's that much of an emergency, should I really be picking out my own music? I don't think I can hear anything. I'm so freaked out. And I remember having my glasses on and I was like, I want to take my glasses off because I thought I was going to somehow see blood flying everywhere. And I was like, I need to take my glasses off. And you just feel lots of pressure and pushing, but you don't feel anything. It's the weirdest. It's so weird.
It's a very weird experience.
Very weird feeling. And I remember when I do remember my OB was there, and then there was the endocrinologist from the NICU was there. She was there. I don't quite know why she was there, honestly, but she was there. And I remember she was this beautiful Colombian woman. She was just like the most beautiful woman I'd ever seen. And she was there when my daughter was born, and she's the one who showed her to me right when she came out. And my daughter didn't cry when she was born. She didn't make any noise. I was so scared. I was so tired. I was so hungry still. I couldn't see her because I didn't have my glasses on. And they had to take her to the NICU because she was underweight and she was small for gestational age. But I remember this woman taking her away, and then it's funny because to this day, I still speak to her. Like, we became very close. She became her NICU doctor. And she took a lot of care in explaining everything to me and being very open. It was only right up until we actually got her diagnosis that things got a little tricky, because it's very rare. And when people don't know, they just resort to, here's what the literature is. And the literature is always really scary.
Yeah.
So you read that and it's, oh shit, like I wasn't expecting this. I wasn't
Yeah.
expecting any of this. Nothing was expected. And now I don't know what her future is going to be. And she's just a baby. And it's so hard when you receive a diagnosis of a baby, because a baby doesn't really have a personality, especially a preemie at 1 day old. Well, she was 23 days old when we got it, but they don't have a personality. You can't look into their eyes and be like, I see you in there. So it was only until recently, probably around like age 2, that I was like, you know what? We're going to be fine. Everything's going to be okay. I see her. She's her own person, and she's nothing like I read at all. Not even close. And it's like you mentioned something earlier about diagnosis and giving a diagnosis. And it's just so important it's so important how it's done, because it can really wreck someone for a long time and leave them with a lot of trauma. And I don't think there's an easy way to do it, but it definitely shouldn't be a printout of things that are going to happen to you.
The way that we speak to each other is so impactful. I don't care what arena we're in.
Yeah.
And I have to say, again, as an OBGYN, I've been in many emergencies, and it really feels, oh my gosh, there's not even a moment to breathe. And I truly, truly believe that the 15 seconds it takes to put your hand on somebody's shoulder, or to hold her hand and look in her eyes and say, this is scary. You're going to feel overwhelmed. We are here to serve you and make sure you're safe and that your baby's as safe as possible. And just be human is always possible. I don't care what the situation is. That those few words, those moments can be so impactful and empowering.
Yeah.
And every day I remind myself that being a patient is so scary. And again, no matter what the environment is, whether it's, an OB, it's not just you, but it's this other life. So
Yeah.
double
Absolutely.
scary. But, whether it's receiving a diagnosis of cancer or an abnormal pap smear, or, you got to really lose weight because you are now obese. All of these words, all of these communiques have so much power and so much impact. And so the way we say it, the way we deliver this news is so important. And thankfully, medical schools are beginning to have literally conversations about how to communicate. When I was when I was a medical student, there was not 1 minute spent on how to communicate. So which is so alarming, because that's mostly what we do.
Exactly. It can really set me off on a path of just being really traumatized, I guess is the best word. Whereas looking back, I missed the first 2 years of my daughter's life because I thought all these terrible things were going to happen to her, and that she would never do this, or that she could die even. And it was just so sad. And I barely remember her being small. And that sucks. But the one place that they do communicate really well is in the NICU.
Yeah, it sounds like you had a great neonatologist.
I did, and every single nurse there really heard me. And one of them heard me so much that she actually helped me get my daughter out of the NICU. So much instinct kicks in, and so much instinct feels robbed when you're there. There's a whole other show about the NICU because it's so hard to navigate. It robs you of a lot of your maternal instinct. And then when you finally do take the baby home, you're like, now she's not on an oxygen monitor. And how do I know if her heart's normal? And it's just, you're on such a schedule there and you're so monitored. But she had a feeding tube through her nose, and she wouldn't latch, and she wouldn't take the bottle. So she was being fed through the tube in her nose. They wanted her to have a G-tube place, which is the stomach tube. And for reasons I can't fully explain, I was against it. Now I'm a little more knowledgeable about the disability community and pediatric disability, and it's a wonderful tool for so many children. I didn't know. I was just going off of like my ableist bullshit. Like I didn't know any better. I was just like, I don't want her to have that tube. But there was also part of it was a maternal instinct saying she's being fed every 3 hours slowly through her nose. Why in the world would she eat anything when I try to feed her? So I convinced Kate, one of the nurses. By this time, Tallulah was already almost 2 months old. She was a healthy weight. And she convinced the doctors to take the tube out. And she didn't eat for a whole day. And then she cried. For the first time ever, she cried for food. And then she started eating.
There you go.
And I thought, wow, I'm so glad I listened to myself. Like looking back, the reason I didn't want her to have the tube was silly. But now I know for a fact she didn't actually need the tube. And I saved her from an operation she didn't need. And I saved her from being in the hospital longer than she needed to. And it was just this moment of, I am her mom. And I don't care how this experience has made me feel. Like I do feel supported by these nurses. I do feel heard by them. They do love her and they care about me. I still, we still talk to them all. It's so wonderful.
I have to disagree with you. I think maternal instinct knows a lot, does know something. And I'm glad for you that you were able to let that come forward, even though it felt insecure. And even though you're like, oh, but they're doctors, they're nurses, they know what they're doing. That it's not infrequent that our own instinct, and how shall I put this? I am so pro-female instinctual response to the world because I think we know a lot. Not think, we do know a lot.
Yeah.
But in the face of that kind of environment, we second guess, and we're our own worst critics. So
I didn't know that moment would be the first moment that I advocated for her. It just became
exactly.
It's looking back, it's funny because now it's just that's all I do, whether it's fighting with insurance to approve something or whatever it is. It's empowering to know that you can really fight for your child.
So we're going to wrap this up. So I'd love to hear what you would say to those families out there who are in their pregnancy or in the NICU, and what would be the wisdom that you share about advocacy and how to stand firm in the face of all that fear?
You just have to listen to yourself. You're probably right. Whatever you're thinking is probably right. And if you're thinking bad things, you're probably wrong. But just trust yourself and really ask for help. If I could have done something differently, I would have asked for help. I have so many people that love me and care about me, and I pushed them all away because I was sad and I didn't want to accept help because I didn't even want to see them. But accept it. Accept all the help. Ask for help. Let people pay a bill for you. Let people bring you food. Let people just take care of you and love you because you need that too. And you can't be much for your child if you're not taking care of yourself as well.
Yeah. Letting people in.
Yeah.
And that's
don't push them out. It's very natural to feel like you want to build a wall around you because you're just sad but don't. It was the more I let the wall down, it seemed like the quicker things happened to get her out of there.
Yeah. Yeah. So we're all trying to find our courage in this life, and we're all trying to find a storyline that speaks to integrity and health and wisdom. And we only get there more often than not through hardship. Yeah. I like to tell my kids, our lives, and without sounding negative, because I'm an optimistic person, our lives are mostly about challenge and hardship. And then we have these moments, these crystals of joy, and they propel us. And when I think about the work that you do with flowers, I was watching you on video today, and you taught me something about how you can have a tulip that is closed, or you called it something I'm forgetting
Reflex.
now. Reflex. And I love that word too, everything about it. Oh, we could just have a whole podcast about that. But looking at a tulip with different perspectives, that's right there in front of you, but most of us don't know anything about it. So if we tell our stories, if we share our experiences with each other, if we normalize the fear, the anger, all the emotional range that we experience during our pregnancies and our deliveries and then parenting,
Yeah.
boy, what a different world this would look like.
There needs to be a lot more honesty around it, because I don't believe that any of these people don't lose their shit.
Yeah, absolutely.
I think it's completely normal. I don't think you could love your kid more than I love mine, and I lose my shit a lot.
It's not about love is incidental, if you will. It's about being in the life.
We need to be honest.
That's right. That's right. Laurel, I'm so grateful for your visit today and your wisdom and fearlessness and your fear and your courage. Thank you also to my listeners for joining me as we venture into the limitless conversations about our bodies and the world of OBGYN. I would love to hear from you. Please email your questions and comments to comments@radiofreerhinecliffe.org or call us at 845-307-7446. Also, thank you to my producers, Jen Hammoud and Matty Rosenberg. Until our next conversation, stay healthy and stand strong in your knowledge and your insights.